Mr. Dragovinovic, many thanks for the invitation. I'm Evangelos Katsikis. I'm a lawyer by profession and an amateur economist. So therefore, I'm not the president of the association, but instead the vice president. I am very honored to be with you to inform you of our common ties and being invited here by Mr. Lebrankos, who is a member of both associations. I was informed that there are many common concerns both in Greece and in Serbia today regarding the financing of the system and the future model of payments. In fact, when Greece hit the wall and the Greek crisis began, the austerity was so fierce that we started seeking out experience in other countries. We opened up as an association trying to find what has happened in other stricken nations and trying to learn from their mistakes. You are, from what I understand at the crossroads in a similar situation. Therefore, the choices that you make are critical for the future of the providers. We discovered that private providers throughout Europe, especially in primary healthcare, face common problems. One of them is the populist approach against them. They are denounced usually, and they have to operate in a hostile environment. A second issue is that they are seldom invited in both the financing arrangements of the system and the negotiations that take place, and also in the regulatory areas. And instead they are presented with the outcomes of these decisions, and then they have to adjust to them. It would be wiser for the associations to participate in order to create a more flexible and sustainable system. We believe that we found also out that austerity is here to stay throughout Europe. The main concern today throughout Europe is cost restraint and the methods that are going to be used in order to achieve that. As you know, the European Union law provides for, does not take account for healthcare. Instead, it leaves it to the local governments through the subsidiarity principle. This has created a variable approach into common problems. If we could share our experience, we could avoid these potential problems. We also have found out that the fee-for-service model is proving inefficient in an austerity environment. Also, the public tender model has several restraints. Of course, this depends on the peculiarities of each country and the way that the social security system is financed and established. We are in favor, we've come to realize that value-based models, along with capitation system and a reduction of the fee-for-service approach is a more viable alternative and should be considered, of course, always taking into account the country limitations. In Greece, what has happened after the crisis is that essentially the entire primary healthcare sector was privatized. At present, private providers account for 98% of the exams and the service in general of the Greek population. However, the financing of the system was not adequately increased. We have found out that this has also happened in several other countries because measures were taken ex post facto. You have a chance maybe to prevent that from happening by building a sustainable system and making arrangements. PPPs are inevitable. The public infrastructure is expensive, it is inefficient, and this was proven by the Greek crisis, given that the public sector provision has essentially collapsed in many areas and is actually serving emergency needs, while the private sector, with a reduced budget, has expanded and also provided better quality of service and increased satisfaction. What is the future? Our idea is that we should cooperate, we should exchange ideas, learn from common mistakes, increase consolidation, look into the future,